Hi all, welcome you at the SugarFit YouTube channel. I'm Venus Singh, a health coach at SugarFit. Today I'm going to talk about the impact of glucose levels on mental health and mood. Fluctuating blood sugar conditions have been observed to cause anxiety, depression, and mood swings. Controlling these emotions are the key to normalizing health, and the first step to do this would be monitoring your blood glucose levels. A reliable way to get biofeedback and derive insights on how the two things are related could be through continuous glucose monitoring. Let's understand the link between blood sugar, insulin resistance, mental health, and mood. The connection between inadequate glucose control and increased incidence of mood problems has been established. But do you know that individuals with type 2 diabetes mellitus have a 20% more chance of experiencing anxiety disorders and are twice as likely to have depression? 90% of the people with pre-diabetes, which have pre-diabetic blood levels, are unaware of their problem. Hence, by the time it is diagnosed, insulin resistance has already set in. Insulin resistance occurs on prolonged excessive exposure to high levels of blood glucose, making the individual vulnerable to mood disorders as well. Now let's understand why are people with abnormal blood sugars and insulin resistance more at risk of mood swings and mental health conditions? Has the diabetes diagnosis traumatized them? Or is it their lifestyle or behavior that's causing anxiety, depression, or decreased wellness? Or is there a strong biological connection between glucose dysregulation, insulin resistance, and our state of mind? Research seems to indicate that it could be a combination of all of the three factors. Whatever the reason, it is clear that there is a definite link between insulin resistance, blood sugar levels, fluctuations, and the onset of abnormal mood swings. So, the best way to get ahead of it or by observing your blood glucose levels more closely so that you can be better prepared to handle mood swings and stay mentally healthy. Studies across a cross section of about 70,000 adults established that diets with added sugars and high glycemic index increases the chances of depression and rated high depressive mood scores. Here are a few reasons that link the blood glucose and depression with anxiety. The number one factor is resistance to insulin in the brain. The brain's center that regulates emotions have insulin receptors all through. These allow the cells to absorb and use sugar for energy. Studies say that since the resistant receptors make them anxious and depressed and prone to mood swings, it could be a contributing factor. The second factor could be decreased brain cell growth due to high blood sugar. The process that creates a new brain cell or neurogenesis seems to be affected in diabetes. This could be because of improper functioning of the mitochondria. There are the parts of the cells that produce energy from sugar after the onset of insulin resistance. In some experiments over mice, it has been observed that when insulin sensitivity is increased through therapies, they result in the generation of mitochondria, reduced depressive symptoms, and increased brain cell formation. The third factor could be impaired wiring of brain cells in insulin-resistant states. Resistance to insulin in the brain disrupts the signaling pathways that make for the ideal wiring of the brain. Now, these cells are connected to the reward and learning behaviors. There is a link between depression and impaired adaptation to stress established via the effect of wiring on the brain cells. The fourth factor here could be chronic stress hormone levels. Insulin has been seen to boost various stress responses. These hormones are responsible for controlling the stress levels. But the resistance to insulin in the brain can disturb the negative feedback on the brain's stress hormone routes. The result is a receptive cycle between dysfunctional insulin and higher stress levels. All of these findings suggest that insulin resistance may lead to depression by inducing stress responses that are abnormal in the brain. The fifth contributing factor could be increased inflammation. Increasing inflammation in the body impacts the brain. It reduces the serotonin activity. The TNF alpha is a pro-inflammatory chemical that is observed to be elevated in diabetic patients. Scientists think that this decreases the serotonin levels in the brain. Now, serotonin is a neurotransmitter involved in depression, and serotonin reuptake inhibitors that enhance serotonin levels in the brain are usually prescribed as antidepressants. High-carb diet. Research indicates that anxiety levels are seen to reduce when a heavy carb diet is changed into a healthy diet of a combination of protein, healthy fats, vitamins, fiber, and minerals. Since the glucose levels are no longer elevated with the new diet, they don't warrant an anxiety response. So the bottom line here is that continuous glucose monitoring is potentially effective biofeedback tool. Using it to minimize lifestyle-driven glucose dysregulation patterns has been seen to successfully decrease consequent rates of depression and anxiety. Have a good day.